Right. Well, I think that there's quite a convergence of quite a few things that were going on during the 60s and 70s that contributed to this emergence of many small, most of them small categorical programs. Probably most influential, I would say, would be the civil rights movement, concurrent with a lot of political unrest. Political unrest stemming largely from the war in Vietnam. The civil rights movement, I think we're all pretty familiar with, but together those two forces, which were very, very prominent, sort of led to a lot of distrust of government. And that distrust of government translated into calls when it came to legislation, budgeting, and so forth, for a lot of strict, precise definition of what government was supposed to do, particularly at the state and local level. So that was sort of one factor. I think another factor was the unrest and the various groups speaking out led to a lot of advocacy. So parent groups, for example, or groups of families then who had been concerned about their children or particular problems became much more vocal. So like the ARC, the Association for Retarded Citizens, really became much more prominent, and other disability groups in particular. There was another thing going on, which was President Johnson's war on poverty. So a lot of the political policy work around that shed light on vulnerable populations, seniors with Medicare passage, and with that came the Medicaid program. So there was attention to a number of vulnerable populations, and so some of the disability groups became active in advocating for very well-defined programs around their issues of particular concern. That sort of coupled with new science. So we had a number of conditions and population groups that heretofore hadn't existed. So, for example, with the emergence of neonatal intensive care units, we had a lot more survival of infants who might have died before, but who had some specific problems. And so we had also basically more different problems emerging in the maternal and child health population, and particularly around the issue of children with disabilities and highly complex medical needs.